Good afternoon, everyone. My name is Josh Parkin. I'm the founder of helpNYC. I want to welcome everyone here today to volunteer mobilization during COVID-19, building resilience for food assistance providers in New York City. I'm so excited to have everyone with us today. I just want to give you a little background on who helpNYC is and what we do. helpNYC is a peer-driven organization that educates, advocates for, and provides direct services to people who are in need. We promote human rights, social justice, and social and economic opportunities. Our belief that people are experts in their own lives is the essence of our work. Our motto is removing barriers, which I'll talk about a little bit in a little bit, restoring dignity, and inspiring hope. Some of our core values that we have are human rights, lived experience, personal dignity, and harm reduction. We believe that everyone has basic human rights that needs to be respected. And our most valuable tool for everyone in this room and those who help the underserved is our lived experience. I pull from my lived experience as a former homeless person in New York City that has survived the shelter system. Personal dignity, we believe is a right of an individual to have control of every aspect of our life. And harm reduction, we embrace the practices which promote dignity, well-being, and access to services and resources. Many of you on the call today, here in the world of Zoom, are listing partners, and you're familiar with our listing process. You may not know the structure because it looks different because it's a relationship that we build with you. But we maintain a list of over 20 types of service covering the SAMHSA 8 dimensions of wellness. And to be a listing partner with helpNYC is that you're identified. Either you come to us or we find you, and we research your program and see how it fits into our listing on our website. Our verification process is not calling up or going to a website saying, okay, you're open from 7 to 9 a.m. Wednesday and Friday, or you provide these services. Our verification process is that we build a relationship with you. We know who you are. We don't call and just verify. You may get an email from me. Sorry, the chat is very distracting. You may get a phone call from me, but we want to build a relationship. And those relationships have been key to why we're here today. People reached out to me in the beginning of COVID-19 going, Josh, I don't know what to do. My volunteers are disappearing. I don't have food. We don't know where to find PPE. So that's how we got here today. And listing. Our information is on the website. What's on our website is what we have. We may have additional notes or contact information, but our information is stored only on our website. This is the key. When I was out on the streets of New York, social workers would spend hours trying to find information on resources for me. And then they would find the information and they would give it to me, and I would go there, and there are many times when the building didn't even exist anymore. And it was either I was hungry or I needed clothing or I needed services, and the organization, the information that my social worker provided to me was not available. So we don't list programs that are high barrier unless there is no other option for that service type. So if there is not a low barrier option, then we deeply research it. And there are a couple listings on our website where it's better to list it than not list it, but we explain that it is a high barrier option. And this is the most important part that everyone in the room today can help us with, is help us spread the word. Our COVID-19 response has focused specifically on getting people in need connected to programs that we have verified. And we don't list everyone because we haven't been able to get in contact with everyone, or people aren't responding. And we think it's mostly because the programs have closed and they're not checking their email or answering calls. They can't. But these are the two ways that you can help us. The ones on the left on the presentation are flyers that the programs can print out. They've been designed specifically so they're easily reproducible. The bigger one is a 8.5 by 11 poster that you could hang up on your door or at your programs if you're closing or if you're still open, so people have access to it. The smaller one is what we call it quad. It's a smaller thing that you could drop in a bag. They come forward to a sheet, and I'll send out the PDF links for these. The ones on the right are our social media postings, and those are also available on our website and all of our social media streams. So why we're here today is that back in April, we had a town hall after we discovered that different people were having different issues, but we didn't know what those issues were. So we all came together and we had a town hall, and it was a very interesting conversation, very much open like it will be today, about what are the challenges. And out of that meeting, me and Char, like, we need to continue this forum, and the Food Assistance Collective was established. It's a forum for food assistance providers to network, partner, and discuss topics that will help their programs, help troubleshoot and provide advocacy for organizations, provide technical assistance and trainings that help programs serve their program participants, a peer-led collective where food assistance providers have control of the conversation, and more. And the important thing is that have the food assistance providers, the people that are on the front lines, to have the control of the conversation, because for far too long it has been funders, city agencies that have had the control of the conversations, and it's been a top-down conversation. And we've found that once food assistance providers talk to each other, problems get solved organically. So that's why we're here today. Oh, wrong. Sorry, I have two computers going on here. And to bridge the conversation, I hit the wrong computer. To bridge the conversation today, I stole this from Stephanie Winters from Hunger. I emailed Stephanie and I'm like, can I steal the quote on your email signature? And I'm like, it's like perfect how to bridge the conversation to who we are to what we're talking about. Volunteering is the ultimate exercise in democracy. You vote in elections once a year, but when you volunteer, you vote every day about the kind of community you want to live in. I think that is a great setup for our conversation today. And with that, oh, I did it again. I hit the wrong computer. With that, I turn the conversation over to my colleague, Charlotte Masters. Thank you.
Hey, everybody. So I'd first like to start by just echoing Josh's gratitude for everyone's attendance today. I feel I can safely say that everyone in this virtual room has less time to spare and is wearing more hats than ever before. So it's even more impressive that you're all here. I mean, the main goal of us bringing this together is that everyone right now is becoming an innovator and adapting at an incredible rate for an exceptional amount of need. And we hope to kind of show that there are some areas where we don't necessarily need to reinvent the wheel. So I'm so excited that our panel today is made up of organizations that were working for volunteer recruitment and food assistance prior to the pandemic and have only risen to the occasion more so in the midst of it. What we hope that people walk away from this with is whether you have utilized any of the services provided by the organizations before or not, that you can leave with maybe at least one new contact, some new information, and the possibility to potentially exhale even the slightest bit, knowing that you're not completely in this alone. So without further ado, I'd like to introduce our panelists. And to the panelists, if you could, after I introduce you, include a little bit about your organization and your COVID-19 response. So if we could kick this off with Ami Dar, who is the Executive Director and Founder of Idealist. Ami, if you could take it away.
Yeah, so hello everyone. Yes, I think we're all wearing multiple hats. If I look a bit tired, if you hear anything interesting in the background, it's because 10 weeks ago, my wife and I had another baby. And so if you hear somebody crying, that's yet another hat in the house. She's awesome. She's called Anna, and she's here somewhere. But anyway, so Idealist has been around for a long time, and I think we're best known in New York as a place for people to find organizations to either work with or volunteer with. When basically this crisis came along, we thought immediately about how we could try to just be useful in some way. And so the two, I guess, big things that we did. One is that when any organization in the world now goes to Idealist to post a volunteer opportunity, they can do something really simple. They can check off the fact that that opportunity is COVID related. And so that allows people around the world to find opportunities wherever they are that are in some sense COVID related. Not surprisingly, many of them are remote. In other words, it can be done virtually. You don't have to show up. And then a whole bunch of them you do have to show up because there's this issue, especially pertinent in this call, food banks need people to show up. You can't really help too much virtually. So one thing that we did was this sort of COVID switch, and we emailed all of the nonprofits on the site, about 100,000 of them, telling them that they could now post these COVID-related opportunities. The second thing that we did is build a directory and a map. One more, there are several of those out there, of course, of mutual aid groups so that people can find the one nearest to them. So we did that as well. That's, as you know, I think all of that's sort of becoming a bigger wave now. And so we just wanted, again, to sort of find a way of getting some more people who don't know about them to be able to find them. All that, of course, is free. And then lastly, I think just to mention that it's been sort of interesting to see how this crisis, I think, has opened conversations. I think on the one hand, people are wearing multiple hats. On the other hand, some people seem to have more time to have conversations that weren't possible before. And I think also more openness to them. So, for example, we have this organization called Volunteer Match that's also been around for more than 20 years. And for more than 20 years, we would have loved to have a situation where anyone coming to Idealist could also see volunteer matches opportunities. And so that happened last week. Like, we finally actually made that happen. And I don't think it would have happened without this crisis. And so I think we're seeing that along many lines where people are more, I think, accessible, available to a series of conversations and opportunities that weren't there before. And so we might as well use that. But long story short, if you go to Idealist, anyone goes to Idealist, any nonprofit, any organization can post COVID-related stuff. Any mutual aid group can list itself. And mutual aid groups can also post opportunities, volunteer opportunities, events that then get mailed out to a whole bunch of people that might be interested. So I guess that's the short version. Thank you for having me.
Yeah, thank you so much for sharing, and congratulations. I think you'll see in the chat that other people share that sentiment.
Oh, I'll take a look.
Yeah. If Darren Jones is Plentiful's New York City client adoption lead. Darren, if you could take it away.
Thank you so much, Charlotte. So my name is Darren. I work on a project called Plentiful. It's a software for food pantries and their clients. It's used by over 200 food pantries in New York City, by almost 500,000 clients who use it to fund food pantries near them. And we've been celebrating our 2 millionth visitor back in February. During the COVID-19 response, we've been working harder to go ahead and actually work with the pantry volunteers to ensure that they're taking proactive steps to understand the software, while also making sure that the people they add to the system are up-to-date information, and also working with the pantries to make sure they send out messages to their clients and their volunteers, letting the clients know about when they're going to be open, change their schedule, and information such as that. And the clients, and letting them also messaging their volunteers, so their volunteers will feel appreciated, know when they should come out to the pantry to help volunteer with unpacking or even distributing food. And also, we've also been working on ways to update the map as well, so therefore clients and people who want to volunteer at a food pantry know when the hours are updated and information such as that. And I'm really excited to be on this panel and hear more from you guys and answer questions you guys may have. So thank you, Charlotte.
Yep, thank you so much, Darren. And from New York Cares, we have two people. We're very lucky. So we have Heather McGreevy, who's the Director of Immediate Need and Public Spaces, and Graeme Laidlaw, who is the Officer of Public Spaces and Events. So if both of you would like to introduce yourselves and then explain a little bit more about New York Cares.
Hey everyone, I'm Graeme Laidlaw. Nice to be here.
I'm Heather McGreevy. Thank you both to Charlotte and Josh for having us. I've been really excited to see some of our partners on both this panel and in the room. Hey there, Amy. We have 29 projects going with Westside Campaign Against Hunger right now. And I'm sure Amy would attest, and both Graeme would attest, that in the initial response to this, it was a bit like the Wild West. Kind of, seeing where everything was and what was happening. I'm going to give you a little bit about New York Cares, who we are, what our response has been, and then I'm going to pass it to Graeme for some specifics in the hunger space. So for those of you that don't know, we're New York City's largest volunteer management organization. We generally have over 50,000 volunteers a year who we mobilize at about 1,200 projects each month. We work with 800 plus nonprofit partners throughout New York City. And we use a team-based model of volunteering. So we have someone who we call a team leader. They are a volunteer who is trained to lead other volunteers. We then match that team leader with a community partner. Those are the nonprofits that we work with. And we're able to deploy teams of volunteers to a project. What that team leader does is it really bolsters the volunteer management capacity for that partner. So making sure that there is somebody to be communicating with volunteers before, during, and after a project, to have an eye towards the operational senses of the project as they relate to volunteers, and to really ensure that volunteers are both useful and have a meaningful experience on site. So we're able to scale based on that model. And as an organization, we have a memorandum of understanding with New York City Emergency Management that we're part of the city's volunteer coordination task force. So what does that mean? In the event of a disaster, New York Cares is responsible for managing spontaneous volunteers. And we're set up to do that really well because of that team leader model, but also because we have an online platform. So our online platform, folks can go on, they can create an account, they could go ahead and do their orientation digitally, which is something that was changed in our COVID response. And they can go ahead and sign up for projects based on their availability, interest, location, etc. They then receive all the information that they need about the project. So they receive a description of the project, they receive the team leader's contact information, where to go, all that sort of fun stuff. So all of that combined means that we can deploy people pretty rapidly. And in the initial phases of all of this, you know, because of the projects that we run on the ground monthly, all of that started to ramp down. We were getting cancellations left, right, and center. You know, all of our programming servicing seniors, that was no longer on the table. Many of our hunger partners weren't sure how they were going to operate. And so we went from running, you know, many projects to just running about 600 projects, which was a very significant drop for us. And as the landscape started to become more clear, one of the things that we decided to do was reach out to all of our partners and conduct a needs assessment. So those were phone calls. Those were direct one-on-one calls with folks. Folks had the option to fill out a survey, but there was a lot of phone contact that happened with partners initially. And those need assessments led us to a real focus on hunger. And so with that, you know, I'll pass it to Graeme. You know, we have other parts of the response, but I think specifically our response to hunger is most germane to this conversation. So Graeme will tell you a little bit about what the experience has been like, us taking on new partners, and then, you know, what our deployment into the space looks like right now.
Hi everyone, I'll try and keep this fairly brief. Yeah, when the crisis first happened, as Heather said, a lot of our partners just didn't know how to respond. So we had a lot of cancellations. We had there was like a bit of it seemed like a pause while people tried to work out what was going on. So our hunger partners we ran about 90 projects a week, and that suddenly went down to about 50 for 3 or 4 weeks while everyone was just trying to regroup. And now steadily we've gone up to, I think we offer 180, 190 projects a week now, so it's ramped up really, really quickly. Obviously the onboarding process with new partners is slower, it's a lot more work. A lot of the partners may only need 2 or 3 volunteers. A lot of their volunteers may be over 50 or are in vulnerable populations that didn't feel comfortable to volunteer anymore, so they just needed 2 or 3 people just to help them go. Some of our larger partners have, you know, ramped up their production by insane amounts and had to move locations to try and to meet the increase in distribution. So we try to be in line with that and try and be as accommodating as we can. I mean, we've gone from hunger being 30% of our projects to now, I think 85 to 90% of the projects that we're doing. And I mean, I think the take home for me is amazing that people are volunteering their time at this time, and people are so willing to help and so willing just to be out there and doing whatever they can. So I'm really glad to be part of this. Thanks.
Thank you both so much. Next, we have Amy Mohidano, who's the Director of Social Services at Westside Campaign Against Hunger. Amy, if you could take it away.
Thank you, Charlotte. Thank you, Josh, for inviting me to the panel. And I just want to say a huge shout out before I start to Plentiful and New York Cares. Without them, we would have no operation whatsoever. Because first, you need the clients to come for the pantry services, and then you need the client communication and, of course, the volunteers to have the work to be done. So, as you know, we're a nonprofit that is a social services agency and an emergency food pantry. COVID happened, and in 2 days, we had to switch our model of being an inside the building pantry and a social services provider in-house to everything being social services virtually and having pantry distribution outside. So our little tiny pantry moved outside. Darren is on my speed dial list on the phone because we needed to let our customers know that our hours were going to change. We were moving from opening 5 days a week to only 4 days a week and in a certain time frame, right? So that's where Plentiful came in. Reached out to Darren. He had all our client database loaded. Text messages were sent out to them in their native languages about our, what was going on with our agency. Social services flyers went out through a text message letting them know what services were being offered and where to call for those services, along with our pantry hours. For the first 2 weeks, we had no volunteers. Our building was shut down. It was only staff only. And we were dealing with the challenge of being very limited in staff and trying to still fulfill an operation. So when we started seeing the client demand increase from our usually 20 to 30 new clients a week to now 70 clients daily new, we were like, now we have to pack more bags. Our mobile pantry operations grew from only 13 sites to now 20 sites. And then, we had a lot of people reaching out to us to be able to do food drop-offs for them. Staff only, not sustainable. Thanks to New York Cares, who is sending us more than 200 volunteers weekly, we're able to do everything and provide much more food to clients now. Our volume has increased by a lot. So we were seeing on a monthly basis 200 new clients. Now we're seeing 900 new clients a month. That's a lot. Our mobile pantry went from dropping off to 13 sites to now dropping off to 20 sites. 2 of those sites were dropping off more than once a month because they serve vulnerable populations. They serve young mothers with children and people who are undocumented. So these people need food more than just once a month. Thanks to New York Cares, we have an operations divided into 3 floors where we have, the proper social distancing space required. We have volunteers packing our grains, volunteers packing our fruits, volunteers packing our vegetables and our protein. And then we have distribution volunteers in each outside in the table setup providing the meals to these families.
Great. That's really amazing to hear how you guys adapted to everything that's changed. Our final, but definitely not least, panelist is Stephanie Winter, who's the Director of Strategic Volunteer Initiatives at Hunger Free America.
Thank you, Charlotte, and thank you, Josh, for putting together this panel and this conversation today. Super excited to talk to everybody about the work that we're doing at Hunger Free America and see if there's ways that we can partner and collaborate with some of both the panelists and also some of the participants as well. So Hunger Free America, if you're not familiar, is formerly known as the New York City Coalition Against Hunger. It started in the 1980s. It's a nonpartisan national nonprofit group working to support the right policies and programs to end domestic hunger. And we are both direct service and advocacy. While we don't do direct food distribution, we do some of those same social services providing that the WISCA does. On our advocacy side, we're always trying to promote policies and support the right measures that will help alleviate hunger in this country. In regards to COVID-19, obviously we all know how impactful that has been to our daily lives. And while there have been many resources, we hear, I heard Ami talk about his mutual aid map, and Plentiful has been able to update clients on the change in hours that WISC has had. So we see that there are these pockets of information, but we still felt there were some gaps, and we wanted to analyze those and also make sure that all the information was available. So we started our virtual COVID-19 food assistance project, which was a way to mobilize volunteers virtually, and then also make sure that the community was receiving the latest information regarding resources available to them through COVID-19. Not only were we using volunteers, but also leveraging partnerships like Plentiful and Food Bank for New York, and getting some of the top-down information, but also getting grassroots information from our volunteers who are calling smaller pantries and kitchens who may not be part of the larger network, who may have been not have some of the technical resources that some of the larger organizations have had access to. This has been a national effort, not only just here in New York City, but across the country. We have had, since the start of COVID-19, sorry, this is my little coworker, over 400 volunteers who have worked on COVID-related work, who've served probably about 1,600 hours. And this has been predominantly all virtual. That's the right timing. 1 second.
I mean, this is the real, right, Stephanie?
This is the real. This is what life is like during COVID-19. And so is impeccable timing. And so we found that through our survey, we were able to not only ascertain the correct hours, but also look at the responses where we were also asking, if we had access to more resources, would that be helpful to you? If you needed help with volunteers, would that be helpful to you? And then we've been trying to connect those pieces of information to areas in which we can help. So if somebody had indicated that they needed more volunteers, we've been trying to amplify that need through our volunteer recruiting website, as well as cross posting. We also sometimes will use Idealist and Volunteer Match to be able to make the broadest catch to volunteers as well. And then we're using volunteers also. We also operate the USDA Hunger Hotline, and which is also available to anyone here in New York as well as across the country to connect to resources. Obviously saw an upshoot in calls that they were seeing. And so they were just much more than our normal staff could handle. So we were able to mobilize volunteers, train them on how to answer calls. And since then, they've been able to answer about 1,500 calls month over month. So that's been fantastic. So, we're operating in a virtual environment too, and normally we're trying to really see that face-to-face time with our volunteers, but to alleviate some of that, one of the ways we have been trying to engage volunteers is using technology. And we've created a Slack workspace for our volunteers and different channels based on the projects they're working on. We found that that has been very helpful in engaging with volunteers. And so that just kind of speaks to some of our COVID-19 response and mobilization of volunteers.
Oh, that's great. And hey to your son as well. We're happy to have him as part of the panel. So you guys have really presented amazing information about what you're doing. And I guess I'd like to start by first asking about, for you, Stephanie, and Graeme and Heather, how organizations can sign up to be a partner with you so that they can have volunteers sent their way. So if Stephanie, if you'd like to start off with that.
Yeah, sure. So they can reach out to me directly. My email address is swinter@hungerfreeamerica.org. I'll also put it in the chat. And we can talk through a relationship and getting you onboarded. We're able to create microsites for every partner organization so that they can have this as a way that it's exclusive to them. And then they'll be part of the larger event listing under Hunger Free America. So that would be the first step to that partnership.
Cool.
We actually have on the call Holly Penzone. If you want to say hi, Holly. I'm not sure if she is able to. I'm not sure if those folks are muted. You're there? Okay. So Holly is on our community partner relations team. She's one of our community partner relations managers. And the best bet right now is to reach out to Holly, and we'll share contact information after this meeting. One of the things that's worth noting, Graeme had mentioned the tremendous amount of new partners that we've received. So right now we're working with close to 80 partners, and about half of those are brand new partners. And so with that, you know, one of the things that's really important to us is that we're delivering quality programming, and making sure that it's a safe environment, both for our partners and for our volunteers. And so, you know, we're starting to take a little bit of time to figure that out. So for partners that might be coming on now, while we might not be able to meet your need immediately, it doesn't mean that we can't in the future.
Okay, very cool. And just so everyone knows, after this panel, we'll be sending out minutes of the meeting to all the attendees as well, so you don't have to memorize all this information. I would like to then direct a similar question to Ami Dar as well, I know you touched upon it, but how exactly do organizations sign up through Idealist if they haven't already? Is there someone who they should reach out to, or can they do it all through the website?
No, thankfully it's through the website. They come to the website, and I think on top it says create organization, so they just do that. Again, it's free. They come from all over the world. I think the only country we don't have is North Korea still, but pretty much every country is there. They come, they sign up. There is a very quick one-day approval process where you make sure that these are not, you know, spammers, commercial entities, etc. There are a couple of basic rules around violence, discrimination, and stuff like that. They get approved, and they can go and they can post as many volunteer opportunities as they like. On the user side, people come to the site, they search. If they don't find what they want the first time, they can sign up to get email alerts of any new volunteer opportunities that come up later, where they are, or by interest or issue. So somebody can say, you know, hunger or COVID-19, and then whenever the next opportunity by any nonprofit in the city or in the world comes up, that will come to your inbox. And so the match can be made that way also, because very often what people look for is not available now, but it might be there later. So let us know what you want, and then we'll be able to sort of send it your way. And yeah, the same thing with mutual aid groups, just straight through the site. And then we also have a support team. So any question that anyone can have, they can contact the support team, and people tend to get back to them within an hour or two, usually during business hours. So yeah, it's totally open, and it's available for anyone, anywhere that wants to help out in some way.
Okay, great. I know most of you touched upon creating a way so that people could now see how close organizations were to them, so they can choose, so that they don't have the commute, as a commute is one of the main barriers to entry for a lot of these volunteers. A follow-up question that I have for New York Cares, for Graeme and Heather, for Amy and for Darren would be about PPE. Are you guys supplying PPE for your volunteers, or are you sourcing it, since you guys have people that you're sending out? So whoever, Darren, I guess you can start.
All right, so we don't really provide any like supplies like PPE for pantries that we work with, but I know a lot of pantries have been ordering from like from their own resources, such as like their funders or even community partners in the area, to give them like supplies such as like face masks, gloves. I know a few pantries who get their software, they bought thermometers so they can like measure temperatures for people when they come in. Also that some other pantries have also been switching to grab and go bags, where they give a bag, where instead of giving them like kind of having them come in and do client choice, they kind of give them a bag, put them on like a table or chair, and then they let the clients come in and grab the bag and go. And also I've noticed that some pantries have also been doing deliveries as well, help out with the demand, and also keeping vulnerable populations at home so they can stay safe and risk the reduction of the spread of the disease.
Okay.
So on the WISCA end, you know, we want to make sure that the environment is safe for both staff, volunteers, and clients. So all of our volunteers who come in, they check in at the front desk, we ask some basic questions about, you know, like their health and potential exposure. Then we send them downstairs to our basement where everyone checks in. And, you know, we there's a sink where everyone can wash their hands constantly. We provide them with gloves, masks, and we were able to get a donation of face shields for our volunteers who are doing distribution outside through Uline. So definitely to those pantries who have always utilized a specific vendor, like in our case, Uline, reaching out to them to see if they have potential PPE equipment that they are able to donate to you, which we were lucky enough to get from Uline. So all our volunteers are equipped with PPE on our end.
Right.
Yeah, from New York Cares End, we asked our community partners to provide gloves and hand sanitizer, and where possible, somewhere for volunteers to wash their hands. We asked volunteers to bring their own face masks. At the moment, it is city guidance that everyone outside should have a face mask. So, we are assuming that volunteers will have their own. We have any of our corporate partners who have offered supplies. We do try and put them in touch with our partners who have requested supplies. So we're trying to, if we have any leads, so to speak, we do try and put them in touch with our community partners who have requested them.
Okay. And to all of you, I guess I'd just like to pose the question of what has been the biggest challenge in adapting to all of this. So, let's see, Stephanie, if you'd like to start.
Adapting to this. My little coworker has been fun and challenging. But I think just, the work that we do is also a lot is driven by that face-to-face contact and face-to-face outreach, and having to pivot and think creatively as we're trying to reach particularly many of our low-income neighbors who may not have reliable internet access and resources that sometimes we take for granted. Even as we're trying to reach out virtually, has been a bit of a challenge for us to think about, and our team has been working diligently to try and make sure they're reaching every single person that is reaching out for help. But it is, that's definitely been a massive task ahead of us.
Yeah. Anyone who would like to jump in next?
I can go. So at Plentiful, in the very beginning, we had to revitalize our entire onboarding process to protect both ourselves and the pantries we were working with. We've also sent out several newsletters to our pantry partners, advising them ways to take precautions during the transition, and also ideas on how they can better serve their community. And we've also been pushing for more pantries to use our reservations, and also helping to reduce the reservations and spreading over time. So therefore, there are less people at the pantry waiting to get in line. The crowds are limited, and most importantly, when people come to the pantry, instead of just guessing a time to go and slow, they're given a time to arrive at the pantry. So therefore, they're able to skip the line or pretty much avoid lines, avoid crowding, and most importantly, get the food they need to and leave.
There's a comment that I have and a question. First is, in terms of PPEs to the community, in my experience, and I'm sorry, I'm Ken Brown, I'm the district manager of Bronx Community Board 5. It's been my experience that the elected officials, the borough president's office has been very good in getting out PPEs to community-based organizations. Are you all aware also that the mayor's office, through the City Parks Department, does give out to the public face masks on a weekly basis, and you can find the locations of that at the mayor's office. If you'd like, I can send the link to that. That's one thing. Another thing, my questions are for Amy at Idealist.
Can
Yes.
you just hold the questions until the open discussion so they're not the recording?
Okay, sorry, I thought that was. Okay.
Thank you. We're not going to record the open discussion so it can be a frank discussion. Thank you.
Sorry, that was my wording, but honestly, that was a pretty great transition because we're just about to close up with to open for the open discussion. I guess before we make that transition, the one thing I'd like to point out that you guys have brought up was the effort towards virtual volunteering, because I don't think it's something that people often think of, and it's something that's definitely getting more attention now that COVID's going on, and it'll be really cool to see how that evolves. And also all of you working so heavily in a virtual realm now with signups and Google Maps and everything that you're having to do is really incredible. So thank you all our panelists for this little discussion. And now we can formally open the floor for all attendees to ask your questions. So Ken, you can take it away.
I also want to thank you all officially on the recording for coming here today. This has been a long month of meeting each individual one of you guys and having discussions. And I'm so glad you came, and we will get the information out to the people that were not here. Thank you. And now let me stop the recording.